Hi, my name is Dan. I'm a student physical therapist from MCPHS, and I'm in my third year of my program. So I am finishing up my third year. I graduate in May, which is 5 months from now. And this is the end of the 3-year program. I have done one other clinical before this. I would say my first clinical was definitely more about just pushing me to start working with patients. I didn't say learn as much as I did here. I definitely learned a lot about manual techniques and exercise progression and just like the fine details of physical therapy and how to better help patients, versus my previous one kind of threw me in just like, this is like the day-to-day of physical therapy. This is how many patients you're gonna be working with, and not as specific about what I was doing or anything like that.
What was your biggest takeaway following Jen and doing the treatment with Jen?
I think definitely working on my pattern recognition, seeing different patients and trying to understand what things in school they taught me to do and what I can apply to specific patients when I see certain presentations. And not only not understanding what I can be doing for a patient, but what things are more valuable to patients. Yeah, so I worked with Matt, Nick, and Danny as well throughout my entire time, and I felt that was a really good experience because I could see different perspectives on how to help people, their ideas on things, which I feel is very important during clinical rotations, is being able to work with different physical therapists, see their view on how to help people, and forming my ideas based off of their mindsets and stuff like that. So I would definitely recommend any student to come here. I felt like I learned a lot, not just about physical therapy, but working with athletes in particular. We have a lot of high-level athletes that come here that their needs are a little bit different compared to any different population. They want to be more active. They want to go back to doing their sports, and this place really helped me kind of understand what their needs are, and also this place taught me how to better treat patients on different levels, and basing my treatment off of their needs. Yeah, no, I definitely feel like I have a better understanding of the PT world. I feel like I kind of learned a lot about different aspects, from billing and note-taking to, like I said before, making sure their patient's time is valuable, to managing a caseload and tailoring my interventions to what they need. And I feel like I definitely have a better understanding what it takes to be a physical therapist in the future when I'm practicing on my own. The previous population, what they needed more was just no pain or needing the strength just to go through their daily life. It's more about making sure they can get out of bed in the morning and move around without pain, or dressing themselves, washing themselves. Here, the patients, their goals are more about getting back to working out or being an athlete. So it's taking them from less pain during their daily life, and then that extra step past that is being more athletic or doing, playing their sport, and understanding that sport is a really important for helping them as well.
If you were to explain to someone the value or non-value of having one-on-one for an hour with patients in a learning environment, can you speak to that?
Yes. So my previous rotation, the place was seeing, or any therapist was seeing, up to 2 to 3 patients an hour. Here is 1 patient an hour, which means that you get a lot more personalized time with that patient, which means I felt like I could really work on what they needed and take my time and, really kind of put in the work of what they needed. And in a learning experience type of perspective, I felt like I had time to think more, time to really practice, and time to test things out even, or anything like that, versus just being like running around from patient to patient to patient. I could take my time with one patient and really see what they're doing and troubleshoot what they're feeling, and really listen to what they're saying as well. And different exercises and different functional tasks and stuff like that, I can really focus on what their complaints are, versus seeing them for not as much time as an hour and maybe handing them off to someone else.
And then how do you feel that helps in the recovery process?
I feel like I can definitely be more with the hour, I can be more particular with what their needs are. I can really break down different movements. I can really kind of take my time, like I said before, with what they're working on, what they're struggling with, and feel like I said before, be more particular and be a little bit focused with what they may need.